Hello everybody. Today we are going to do another penile implant. The patient is 50 years old, is coming from Australia, Melbourne, and he is suffering from erectile dysfunction for several years, and he used PD5 inhibitors, Viagra and Cialis, which didn't work, and also tried injections afterwards, and the injections also failed to treat his erectile dysfunction, and he decided to have a 3-piece implant. We are going to do a Coloplast implant on this patient. As you know, Coloplast has a lifelong warranty and is 3-piece prosthesis which can be soaked in antibiotics and can absorb antibiotics and then release antibiotics for several days. We are going to soak the Coloplast Penile Prosthesis in rifampicin and gentamicin, combined rifampicin and gentamicin during the surgery, and then put the implant in. The satisfaction rate with the penile implant for patients is between 97 to 100%, and also we achieve the same percentage also for the partner satisfaction. So the Coloplast, the advantage of Coloplast is has the lifelong warranty first, and also you can choose the antibiotic to soak the prosthesis in. In other words, I mean, especially for the redo cases, you can combine the antifungal agents with rifampicin and gentamicin, amphotericin B, which can also cover the fungal infection prophylaxis. So we are going to do step by step, and I will inform you during the surgery about the procedure. And, we are going to do 10-minute scrubbing for the patient with betadine in order to decrease the the Staphylococcus epidermidis ratio on the skin, to decrease the skin infection. And also the patient had further antibiotic prophylaxis in terms of also the patient had additional antibiotic prophylaxis with 3rd generation cephalosporin and vancomycin, 1 milligram twice a day. And with this protocol, we did cover gram-negative bacteria, Staphylococcus epidermidis, and also the 3rd generation cephalosporin also has some anaerobic coverage. The fungal coverage is missing, but for the fungal coverage, we usually don't do for the primary cases fungal antibiotic prophylaxis. So the scrub procedure is completed. Foto yükselt dedik şey.
Yükseldi hocam. 60'ta şu.
On both sides, the dilatation is completed. The length of the corpus cavernosum on each side is measured to be 12 plus 8 centimeter. So we end up with 20 centimeter. We are going to choose 18 centimeter cylinder and with 2 centimeter rear tip extender. The measurement is performed with furrow inserter. So furrow has the mark for in centimeter, and if you put this on one side to the proximal side, you will see the length of the proximal corpus cavernosum, and we did measure the proximal corpus cavernosum to be 8 is equal to 20. And we are going to put a 18 plus 2 centimeter cylinder. During the procedure, no complication. We didn't face any complication. the major complication during the surgery is again to compromise the deep dorsal nerve. We saw the neurovascular bundle and we stayed lateral to the neurovascular bundle, and also the urethra was also not perforated. The urethral perforation test is performed with a syringe of 60 cc's with a syringe of 60 centimeter. We push the saline into the distal corpus cavernosum, and we shouldn't see any fluid coming through the urethra. This is the check of the complete urethra. Urethra is not injured, in other words. So during this time, the assistant is the nurse is preparing the prosthesis. Again, the Coloplast 18 infrapubic type. He tiered the cylinder coverage. Now, first of all, he will do what we call is air bubble free cylinder, and then he soaks the cylinder with antibiotic solution, which is composed of rifampicin 10 mg ml and gentamicin 1 mg ml, right? And the prosthesis is soaked for several minutes in this antibiotic solution, combined rifampicin plus gentamicin, and then he will do a negative air bubble free cylinder. And the prosthesis will be ready to place in. This is the air bubble free step during the preparation of the prosthesis. Negative pressure is applied to the cylinder with 50 cc syringe, and then rubber rubber shot clamps prohibit the air to go in. Afterwards, in the second part of the preparation of the cylinder is washed with saline 50 cc syringe, and the integrity of both cylinders are checked, and also the pump is also checked in terms of functioning. Pump the prosthesis up. So this is the final appearance of the penis in the inflated state. The axial rigidity is very nice and should be at least 1 kilogram. In other words, if we apply a force of 1 kilogram, the penis shouldn't buckle more than 5 degrees, right? As you can see, this is the force of approximately maybe 2-3 kilogram, and there is no bending of the penis. Sol tarafa girdi mi? Al, flash tut. Ver eldeki enjektör. Al. Dur, tut şunu.
Evet.
Bakayım.
Şeyde kalmış, dışarıda kalmış.
Hadi işte. Çok şeyi. Ne yapıyorsun? Kes hadi kes. Gel bakayım karşı tarafa. Hemen. Inguinal canal by piercing the transversalis fascia to the paravesical space. Now you can see the preparation of the reservoir. This is a special type of reservoir. It's called Coloplast and is an alternative reservoir type. The capacity of the reservoir is 75 cc's, and it will be placed to the paravesical space. Bekle.
Tamam.
Tamam oldu şu an.
Tamam.
Okay. Aspiratör ver. The operation is completed, and we take the sutures at the glance off, and the patient will not suffer anymore from erectile dysfunction. He will be taught to cycle the prosthesis as soon as possible, because, as I said at the beginning of the operation, this is an infrapubic incision, and he will be able to use the prosthesis after 6 weeks. If you are interested to have an penile implant in Istanbul, Turkey, please contact Men's Health Istanbul.